Well, today's great health takes us from one of the lowest moments of a man's life to one of the highest spots on earth. It starts with a scare here in central Indiana, and as Scott Sander tells us, winds up on top of Africa's tallest mountain.
We still got about another half hour.
To reach the soaring peak, that man in red needed timing, a tiny device, and a doctor who truly understood.
I had a heart attack.
Steve Meier explains the story in an exam room he knows well at Community Heart and Vascular Hospital. At his side is Sandeep Dubey, the doctor who helped Meier repair his heart and reclaim his very high hopes.
So Mount Kilimanjaro has been on the very top of my bucket list for 20 years.
As fate would have it, Dr. Dubey had recently made the same hike.
We're covered in hoods and jackets, and still the cold gets into your bones, and you are wondering what you are doing here.
This is fun.
Yeah. So
The shared passion helps explain the reaction Meier got when he ran his plan past his new doc.
He said, "Oh yeah, go for it," and he told me what I needed to do.
Steve was hiking before. He was very active. He was motivated.
Recovery meant life with a small but permanent stent to strengthen weakened blood vessel walls. Meier also had to strengthen his body without overtaxing his healing heart. And even then, scaling any summit would be no sure thing.
The hard thing is, in Indiana, there's just no way to train for altitude. And altitude is just such an unknown.
But Meier made it. Just 10 months after a heart attack that laid him low, he was mountain high, standing almost truly on top of the world.
Steve is a great example of somebody, that shows that life doesn't end if somebody had a heart attack or event like that. They can go back to their normal life or even do better than what they were doing before if they take really good care of themselves.
There's a sign up there at the very top, and so it's an obvious place where you want to get your picture taken, and I got one with my arms outstretched and then another one holding the banner, just thanking community for their care for me.
The biggest lesson for the rest of us who are not climbing Kilimanjaro may be what Steve Meier did not do, but now wishes he had. 6 weeks before his heart attack, he started feeling some of the mild then moderate pressure that may indicate a heart attack is coming. He ignored it. Dr. Dubey says his patient should have gone to the doctor immediately. He says that Meier's body was trying to send warning signs and that ignoring them for that long would have been a fatal mistake for many people.